Hello and welcome. My name's Alan Matsumoto. I'm chair of the Department of Radiology and Medical Imaging at the University of Virginia here in Charlottesville. I'd like to welcome you all to our institution for your virtual visit. Diagnostic radiology and interventional radiology, which I'll call DR and IR, are clearly two of the best specialties within medicine. What other specialty impacts the lives of so many patients in a single day? We interpret more than 650,000 diagnostic exams a year and provide more than 10,000 image-guided procedures for patients every year. Think about that. That's touching more than 1,000 patients and families a day. No other specialty can do that.
Hey y'all, my name is Ellen Falk. I'm one of the first-year radiology residents in the diagnostic program here at UVA. Lots of things made me choose UVA as the place where I wanted to do residency. The first and most important is that I wanted an environment that would be both challenging and equally supportive, and I've definitely found that here. Being from Louisiana, I have to have a place to live that has a great variety of food and things going on in the city. And even though Charlottesville is smaller, there's still a bunch of things going on and fun events to go to and places to eat at.
Charlottesville is known as a city that's easily accessible to the outdoors with many hiking trails, mountain biking trails, as well as outdoor water sports. There are more than 45 wineries within a 30-mile radius of Charlottesville. We're also situated at the base of the Blue Ridge Mountains.
Hello there, my name is Josh Knight. I'm one of the fourth-year residents and also one of the chief residents. I have a couple of different reasons why I chose this program. Each of the divisions here are outstanding. I came in initially thinking I was going to do MSK, and as I rotated through the divisions, I started to see maybe I could consider breast or body or even IR. And now that I'm in my fourth year, I am continuing with MSK, but I'm really grateful for that experience because if I enter a private practice, I've got a great breadth of knowledge from each of these strong divisions. And the last thing that really brought me to UVA was actually the people. It's truly felt like family. Even though I'm originally from Richmond, I've got my second family here, and I'm extremely grateful for the University of Virginia.
Our department is really looking to recruit excellent trainees. While some departments will say we're always looking for the best and brightest, what we are actually looking for are trainees that want to make a difference. We want our trainees to be active and engaged learners. We want our trainees to help us become a better department because no matter how good we think we are, there's always room for improvement.
Hi, my name is Megan Clark and I'm a PGY3 Interventional Radiology resident here at the University of Virginia. I came to UVA for a lot of reasons. One, I was really drawn to all the people of this program, from all the attendings, both in diagnostic and interventional radiology. All the residents were so warm and welcoming, and I could really sense the camaraderie when I came to visit as an interviewee. And so that was something that I was really desiring in my residency program, and I found that to be completely true and even better than I expected once I got here. Another thing that our interventional radiology attendings I think really shine at is their patience. They are so incredibly patient during procedures. And even when we're struggling a little bit, they're really good at talking us through or getting us over a hurdle, but not just taking the case over from us or taking it away from us. They make sure that we understand how to surmount that hurdle the next time we encounter it.
We are curators of large volume of information and data that impact so many lives of patients. This is where it even becomes more exciting. We can leverage this data to use augmented intelligence, machine learning, to really drive the direction of healthcare. This is why many of you that are looking for DR and IR have chosen the best field. We are very fortunate to have a very strong research infrastructure. Think about systems engineering, we need you. Think about data analysts, we need you. It all ties into the provision of clinical care. This is why our specialty is so cool. We can develop devices like stents, stent grafts. Think about theragnostic medicines, creating targeted therapies at the micron level, the nanometer level. This is what's going to change healthcare. We are going to be at that nexus, providing phenotypes of imaging characteristics that informs not only therapies, but which patient should receive which specific therapies.
Hi everyone, my name is Yasser Al-Abed. I'm one of the PGY6 residents in the IR program here at the University of Virginia. The new IR space is part of a brand new hospital expansion for UVA that opened in January of 2019. One of the the coolest things we have, which is a one-of-a-kind design in the entire country, is a CT scanner on rails that sits between two rooms that it can go between. This is actually designed from the ground up for UVA. It doesn't exist anywhere else in the country.
As part of our mission in terms of education, we want to expose our trainees as well as our faculty to many developmental opportunities so that they can pursue their passion and their professional growth opportunities. We have been very fortunate that we've been able to secure funding from donors to establish new programs. An example of one of the programs is a Global Health Leadership Track.
Hi, my name is Sonali Ranjeev. I am a fourth-year resident at UVA. I am part of the Global Health Leadership Track and have been part of the program since my first year. The program is unique to UVA in that we have a really good partnership with residents in Mbarara, Uganda, and we're able to travel over there once during our second year and once during our fourth year to meet with the residents and teach them in person.
Another program is we've garnered funding from a donor to establish a diversity and inclusion program. This is to help us grow the diversity. This is critically important for our specialty in order for us to better serve the growing diversity of patients that are touched by our imaging and image-guided therapeutic services. We also have a very strong alumni association called the Keats Society. This society raises funds to help support numerous educational endeavors for our residents and also well-being events. And importantly, when it comes to finding a job, we have a network all over the United States to help to create jobs. Our residents, we're very proud of them. They're part of us and who we are. And I would say that the majority of our faculty are here because of our residents. They love to teach, they love the interaction, and they love to be challenged. We hope that your visit with us is fruitful and that we have been able to answer many of the questions that you may have about our program, our institution, and who we are. Welcome.